Hello lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we're talking about oculoplastics. Ophthalmology or plastic surgeon? Which one would you choose? Stick around to find out what my opinion on this is and a few disclaimers. I do feel that what I'm talking about today is a little bit controversial because of where I work. So obviously I do have I guess more of an inclination to having this opinion as opposed to the opposite. Having said that though, I hope that I do explain why I have this reasoning and maybe even give you some examples as to other events that have confirmed this kind of opinion in me over the years. So having said that, yes, I am an orthoptist. Yes, I do work at an oculoplastic practice. We do so many other things except for oculoplastics. It's just one part of what we do. But the other part of what we do is we see a lot of unhappy patients who need their oculoplastic work fixed, and that's a really hard job. And even though I work for an extremely talented, extremely careful and a doctor who is very meticulous and precise with her work, so I'm very fortunate, maybe even a little bit more reserved than some patients would like her to be, which I personally, as her co-worker and colleague and employee, really appreciate it, because you know it's always better to be safe than sorry, and that's definitely her approach. So I work with a really fantastic doctor who doesn't so much focus on the aesthetic side of things. And let me explain. So yes, of course, we're always looking to have an outcome that looks nice, that makes the face youthful and all the things. But when an oculoplastic ophthalmologist does a surgery, it's all about the eye's function. No matter what you do, that's the basis of what we're trying to aim for, which is really amazing, because never in your life do you want to look nice but have tears rolling down your face, you can't see, your vision's blurry, your eyes are chronically dry, you're stuck with drops and treatments for the rest of your life, you're never comfortable, your eyes are sore, you can get migraines, you can get muscle tension, you can get all these sort of symptoms that come with dry eyes, or that come with eyes that don't function properly, all because when they remove skin for the corrections, they don't do it right. So in order to really understand where I'm coming from, we've got to explain what the main kind of surgery that we see is, and that is a blepharoplasty. Plastic, so change, blepharo, lid. So when someone has aged and their things have all kind of sagged like this and the muscles just don't work anymore, you get all this excess skin through the brow. Typically it happens, you get a bit more fat here, a bit more puffiness here, and a lot of kind of drop down here. In order for it to be an actual oculoplastic or an ophthalmological problem, it has to affect the actual peripheral vision. The other thing we very often see is ptosis, so when the lid has dropped down enough where the actual lid itself has covered the pupil and it obstructs the vision that way. The other thing is functional, so the lid has misshapen because of that gravity so much that the tears cannot flow in and out of where they should. And look, there are several other reasons, but that's probably the main sort of topics that we deal with. And with those patients, it's really sort of a delicate line that you're walking. Often these are people who are middle-aged, not necessarily in their 80s and 90s. Obviously, they still very much do care about how they look, and so they should. That's great. And these are people who are in the professional world still. Typically, they're still very much fully fledged members of society, so you don't want to be giving them a very long recovery either. So when they go and see a plastic surgeon, they want a brow lift, or they want something to deal with the appearance of their eyes. Typically when you go to a plastic surgeon, your issue is very much a physical one, an aesthetic one, a cosmetic one. And a lot of plastic surgeons very successfully remove the correct amount of skin, shape the eye in the correct kind of way, and the patient is left very happy with a fully functioning eye that drains and creates tears and blinks and does all the things extremely correctly, plus they have a very nice cosmetic result. Most patients. But occasionally, and this happens more often than even we think You know, every time it happens, we still get a bit of a surprise because, you know, just different mentalities. You get this patient that is way more keen to look a certain way, and no matter how much you explain that if we give you this look, you're going to be miserable. You might like your reflection, but you're going to hate the eyes that are looking at that reflection because they're going to be uncomfortable, they're going to be dysfunctioning, and they're going to cause you a lot of grief. And it's going to be something chronic that will only get worse as you age. And so a lot of the time, it's a little bit of talking someone down the ledge, off the ledge, because they really are quite set that they want a certain aesthetic result. And a lot of the times, they don't really appreciate how horrible that aesthetic result looks. It reminds me of what my grandma always used to do when I was growing up. So she's a very young grandma. She's only 46 years older than me. So, you know, for a grandma, that's super young. And she would always sort of joke that, you know, one day she'll collect all her skin and tie it in a bow at the back of her head, and that will just be her look. And a lot of the time, you see these plastic patient post-ops, and you think that's pretty much what they've aimed to do. They're just going, you know, and tied it all up in a nice little bow at the back. Not cool. My biggest challenge professionally is when I see these patients is not to go, what did they do to you? You know, obviously that would be very unprofessional, and that would be extremely incorrect to presume anything and so forth and so on. But, you know, it really does take a lot not to go, what did they do? Because a lot of the time, it's not even the surgeon's kind of intention to do that. It's just that the patients are sometimes really, really pushy. And when you're working for aesthetic outcomes, when you're working for a certain look outcome, you are pressured as a surgeon to get certain results. And if you're not an ophthalmologist, how do you know? If there's a plastic surgeon watching this, how do you know what the eye's function was beforehand? Did you do an ophthalmological review before? No, you didn't. How do you know how the patient will then recoup afterwards, and what's going to be their 5-year outcome? You don't know. You didn't do an original assessment, and you don't know how eyes basically function because you don't care. Is pretty much the basis of it. You know, a lot of the plastic surgeons that I'm familiar with that do these types of surgeries, they're used to doing, you know, liposuctions and breast augmentation and body sculpting, and I take my hat off to them for doing that sort of surgery because it looks really complicated, and they must be hella knowledgeable to be able to pull something like that off on a daily basis and call it a job. It's fantastic. I'm in awe of that. However, eye surgery, you're dealing with the tiniest little amount of skin. And if you take even, you know, 1/10 of a millimeter more than you need to, or leave 1/10 of a millimeter more than you should have, you get a very different aesthetic outcome and functional outcome. So when you see an ophthalmologist, I'll take you through the process. They take you in. The first thing they'll do is they check your vision. Just very basic. What can you see on the chart? You know, a bit like the general practitioner would, or your family doctor would. Nothing too complicated typically. In your glasses, without your glasses, whatever. It's not such a big deal because you're not there for the vision, right? If your vision isn't great, they note that. That's already one big foot through the door. They will always have a look at your surface. So when we refer to the surface, we talk about corneal, tear film, conjunctiva, all the things that sit visibly to the eye. They'll check under the lids, they'll look at all the muscle structures, they'll look at the nerve, they'll look at why the eyes are functioning this way, because it might be an underlying condition, and then they'll address accordingly. And usually it does result in the surgery that the patient wants. We don't often turn patients away. It does happen frequently enough, but it's not the usual outcome. The other thing is, if this patient already does have underlying condition, it needs to be addressed. You know, you don't have to worry that the surgery won't go ahead. It's just that aside from the surgery, that, you know, gives you your confidence back, gives you your functioning back, makes your whatever issue you've been having more practical to deal with, all the things, you know, gives you your peripheral vision back, confidence driving, all that sort of stuff. Yes, of course, we are going to worry about that. We also look at your mental health. You know, is it giving you anxiety? All the things. Like we're not going to be saying, oh, plastic surgery is null and void here. No, nothing like that. We still very much consider the value and the importance of a plastics procedure, which is why we do what we do. However, if there is an underlying problem, which quite often there is, wouldn't you want someone picking that up and dealing with it for you instead of going through a very expensive surgery, a pretty decent recovery? I think it's like 2 weeks until you sort of feel like yourself again. And then to just find yourself where you started, which is with your underlying problem in the first place. Also, recurrence. Some of these problems will cause the lids to repuff, resag, redroop, all the things. So you definitely want someone who's sort of more medical, looking at you from a medical point of view, not just how your face looks. So just the other day, and this is probably what sparked today's topic, is a lady who was extremely distraught, who had seen us several times now, because a few years ago, she had her eyes done by a very reputable plastic surgeon. And I have to say, the actual surgical technique looks really nice. Her skin is smooth, the shape is beautiful, like all the things. But because he's not an ophthalmologist, he did not consider a very, very important thing. At least it's important to me. As someone who deals with this every day, I think it's a very important thing. He didn't consider that when he pulled up one lid, the other one wouldn't follow through. And the reason he didn't consider that is because he didn't check the functioning of the lid. Because why would he? He's a plastic surgeon. They probably don't even have the machines necessary, the microscope necessary to have a proper look. The other thing is, no one ever checked for her eye health. And it's just a quick general review. It's not an in-depth review like the kinds I do when I work with my surgeon, where we, scan the back of the eye and do all the things. It's pretty basic, but it's enough to pick up anything that isn't, doesn't belong, anything that shouldn't be. Because that's the time when people, unassuming that they have anything, often get diagnosed. They come in for a general issue or a different issue, and then they end up being diagnosed with something far more important. And it was their lucky break. There's no lucky break when you're going to a plastic surgeon, except for maybe being told what else is wrong with your body. I mean, there are definitely plastic surgeons that look at you and go cha-ching, cha-ching, cha-ching. I'm not saying that's all of them. I'm just saying that has been an experience as well. So this plastic surgeon has had really great outcomes before. It's just that this particular time, he didn't take that certain thing into consideration. And frankly, most people, especially younger people who are having these surgeries, don't have this underlying function. But when you're dealing with someone a little bit older or a little bit more demanding, perhaps, you just got to walk that line with great caution. And I can't guarantee that if we had done the surgery, she would have been happy. I can't guarantee that. But one thing I know for sure, because I've known my doctor for that long, that she would not now have this saggy lower lid due to her upper lid being corrected and her lower lid being left behind, causing severe dry eye, causing extreme blurry vision, causing very great discomfort. She sat there and said, I just want to squeeze my whole face so I can squeeze some tears out. And I said, well, that won't work, but I totally get how you would feel that way. And I feel terrible for her because, again, not to say that she would have had a different outcome had she come and seen us, but I just feel like he just didn't do his full due diligence in the first place, because had he done that, he would have just put in a few extra stitches at the time and avoided this whole entire situation. I make it very simple to say a few extra stitches. There's a lot more technique involved than that, but it would have been just one little extra step in terms of surgical planning, and all of this could have been much less of a headache for all involved. So if you know anyone who's considering eye plastic surgery, and they're not sure who to see, and they've got a choice between someone who is an ophthalmologist or an eye doctor who's reputable, who's got a good reputation, good results, but they will also at least check on the health of the eye, I would prefer that path. And even in other kind of areas of medicine, that is the path I prefer. For example, if I was to ever need nose surgery, another common plastic procedure, I would not go to a plastic surgeon. I would more likely go to an ENT who will then also address other sinus, breathing, etc. issues. I feel like that's the way to go, because these are people who are experienced with more than just the aesthetic outcome. There will be plastic surgeons out there who also take these considerations, but I would at least open that dialogue with the doctor beforehand, that your expectation is not just to look good, but also to function well. And just remind them that they're doctors. They're not just, fairy godmothers of youth. I feel like that's really something that has just culturally taken over in this space. If you're someone who has a really great plastic surgeon who's already chosen their doctor and is really happy with their choice, I am all behind you. The only thing I would do is perhaps beforehand just go to the optician, optometrist, and just have a general eye checkup. Make sure that there's no underlying issues that the plastic surgeon won't possibly have the equipment even or the time to review. Make sure there's no dry eye. Make sure the actual lids are functioning well. There's no underlying chronic condition like, say, blepharitis, where the lids have a tendency to be swollen for different reasons, etc., etc. There are a lot of facets that we look at, including just vision. You know, make sure that the vision is at whatever level it is. It doesn't even have to be necessarily corrected. It's just a matter of knowing what your starting point is, so then you can measure up relatively where your end point is and have a management plan in place if you need one. Okay, my lovelies, I hope that today's video was informative. This is a very, it's a very poignant topic for me because we see so many botched surgeries, and sometimes patients aren't even aware of the fact that they've been botched a little, and we manage it and it's fine. A lot of the time the outcome is okay, like it's fine, but there are those, I don't know, maybe 5% of patients that are left really unhappy, and you know, not to say that the surgeries that we do at my practice are all perfect in terms of patient result. They're not, but the technique is done with the eye as a whole, as the organ as a whole in mind, which is the biggest difference. If you want to see more videos like this talking about eyes, please do subscribe, and for more things all about my world, which has so many layers, please head over to Instagram. I hope you're doing really well wherever you are around the world, and I can't wait to see you on the next one. Bye.